female. What was the age, sorry? COVID positive as well?
I'm Emma Hall and I'm an Associate Nurse Manager at Alfred Emergency Department and Trauma Centre.
Alfred received, we'll see you when you get here.
It's been incredibly challenging. It's like going from 0 to 1,000. All the plans that we've had have now had to become reality.
So we've had lots of COVID positives today. We've got another one coming through who's quite sick. This is our COVID navigator who's bringing the patient through into a designated room.
Historically, you'd move a non-COVID-19 patient to the ward and it would take one orderly. Now you need 2 orderlies, one to push, one to clean. You need a COVID navigator to really make sure that we're not missing anything in terms of infection prevention.
Attention staff, may call infectious disease.
Essentially double the resources for one patient is the best way I could describe it.
So this gentleman has just tested COVID positive. He's requiring high flow oxygen and he's really quite unwell. So his oxygen levels have dropped down into the 80s, that's the lowest it's been. So we're just trying to manage him at the moment. But he's very distressed and he's working really hard.
Eventually he just got too tired. He'd been working pretty hard at home for quite a few days. And the decision was made that if we didn't put him on a ventilator that he would probably deteriorate and have a cardiac arrest. I know that he went to ICU. Unfortunately, in emergency, you get half the story. So a lot of the time you don't get the outcomes, but I hope he's okay. As well as the COVID patients, we're dealing with lots of trauma patients and what we would consider business as usual patients, so heart attacks, strokes, and those kinds of patients that present.
Tonight's one of those nights where we have over 80 people in the department. We've had multiple cardiac arrest patients who are really unwell, requiring ICU. On top of that, lots of COVID positive. At the moment, we're looking at over 25 people who are isolated in the department with more critically unwell trauma patients on the way. We've just received a truck rollover and a stroke.
Ready, set, and go.
We're just running tonight, absolutely trying to find every way to get everyone into the department to be seen. But we're finding, that's becoming more and more difficult every single day. So this gentleman has dropped his conscious level and he's got COVID. He's really unwell. We had to rush him in. We didn't have a lot of room, but we had to find a bay quite quickly. He's elderly and it's not looking great.
It's hard to know that that's all you can do for them. You can just keep them comfortable and try and get them to the next stage and get them through it, but there's a high chance that they won't get through it.
So it's Saturday morning at about 8:30 and I'm exhausted, as are all my colleagues after last night. Historically Friday nights were mainly around dealing with trauma, patients who have used drugs or alcohol, but tonight it was primarily about young COVID positive patients presenting to the emergency department via ambulance. And for me personally, it was a real eye-opener. It was confronting because it was the first time in this whole pandemic that I finally realised how difficult it's going to be in the next few months. But we're resilient and we're going to look after everybody. But somehow I don't think we're all going to be the same people after all of this.